Yeah, okay, I'll just wait for confirmation on that one. I can confirm the webcast has started.
Thank you. Welcome to this meeting of the Joint Overview and Scrutiny Committee for the Hampshire Together programme. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being live streamed and will also be available for repeated viewing. During the meeting, if a member wishes to speak, they will indicate and we'll call them to speak in turn. Otherwise, their microphones will be muted. I begin by reading the names of members on the committee so they can confirm their attendance for the public record. I'm Councillor Roger Huckstep. I'm chairman of this committee. My vice chairman is Councillor Anne Briggs. Anne, can you just confirm your
present, Chairman?
Thank you. Councillor Frank Carpenter.
Present, Chairman.
Councillor Rod Cooper.
Yes, present.
Councillor David Harrison.
Yes, good morning, Chairman.
Good morning, David. Councillor David Keast.
Present, Chairman.
And Councillor Professor Barry Margetts.
Present.
And finally, Councillor Mike Thornton. Councillor Mike Thornton. You're muted, Councillor Mike.
I've got to unmute. Yes, good morning, Chairman. How are you?
I'm fine. I hope you all are, and welcome to everyone, including our observers and all our presenters. So, for the record, observers are not members of the committee and therefore should not speak at the meetings or take part in any voting. So now we can move straight on to the agenda. Apologies for absence. I don't think we have any apologies. Is that confirmed, Marie?
That's correct. All members are present, so we've not had any apologies.
Excellent. Right, item 2, declarations of interest. All members who believe they have a disclosable pecuniary interest in any matter to be considered at the meeting must declare that interest and, having regard to the circumstances described in Part 3, Paragraph 1.5 of the County Council's Members' Code of Conduct, leave the meeting while the matter is discussed, save for exercising any right to speak in accordance with Paragraph 1.6 of the Code. Furthermore, all members with a personal interest in a matter being considered at the meeting should consider, having regard to Part 5, Paragraph 4 of the Code, whether such interest should be declared, and having regard to Part 5, Paragraph 5 of the Code, consider whether it is appropriate to leave the meeting while the matter is discussed, save for exercising any right to speak in accordance with the Code. Do any members wish to make a declaration at this point?
Chairman, can you hear me?
Yes, I can.
Sorry, my screen has gone completely blank, and it's gone all. I can't even change anything on it. I'm going to have to see if I can go out and come in again, but I'm going to have to turn everything off because I can't actually reach anything on the screen.
Well, we can see your avatar. We can hear you.
Yeah.
Give it a try if you like.
Okay, I'll see what happens.
In the meantime, we'll continue with the meeting. Right, item 3, minutes. Minutes of the last meeting, 18th of December, were published on Friday the 5th of March and members notified. They are available on the web and as supplement in ModGov. Are they agreed as a correct record? I see.
Agreed.
I hear no dissension, so we can take those as agreed. Item 4 is deputations. I have received no notification of deputations. Is that confirmed, Marie?
That's correct. We've not had any requests to speak this time.
Thank you. Item 5, Chairman's announcements. I have no announcements at this time. So we can go straight into the meat of the meeting, which is item 6, which is the Hampshire Together programme, progress and update. And this is to receive an update and officers in attendance to present are Alex Whitfield, Chief Executive of Hampshire Hospitals Foundation Trust, Ruth Coburn-Jackson, CCG Lead for North and Mid Hampshire, as well as Dr. Lara Alloway, Dr. Matt Nisbet, and Elliot Nichols. Alex, are you going to start?
I'm going to start. Yes, we have a few slides just to frame it. So, which I think John is going to share. My first few slides are really a slight recap on the programme. And then Ruth is going to take you through a bit of an update on what we've been doing since then. And Matt is going to share a little bit of the vision in this section. So it's me, then Matt, then Ruth. So in terms of the programme, I think most people are familiar, but just in case, Hampshire Together, modernising our hospitals and health services. It's come out of the government's programme for new hospitals. We are part of the second round with a construction of a new hospital aimed for between 2025 and 2030. While the money and the programme is about a hospital, we believe that this can be a catalyst for a lot more. And so for us, this is a lot about changing how we provide care, to do lots more things close to where people live, using digital technology, using our really dispersed real estate, such that the hospital building we build only needs to do the bits that you really, really need to come to a big new hospital for, but the vast majority of care people receive will be closer to where they live. And we received £5 million about a year and a half ago to start developing the plan, and that's what this is part of. It is for the people of Mid and North Hampshire. So if you go on to the next slide, we shared this map a bit with you last time, which is what is the system we are talking about here, because it isn't actually the whole of Hampshire for this specific programme. It is what we call Mid and North. It covers 509 LSOAs. And this chart we have updated based on your feedback last time, where we had a question about Surrey and how much did the Royal Surrey interface, because we hadn't included that on this map. So if I just explain very briefly about this map, if you look at the top right-hand corner, you can see some solid purple bars. What that means is pretty much everybody that lives in those particular areas uses Frimley Park as their main hospital. And I believe, one of the councillors here represents that, some people in that area. So those people use predominantly Frimley. As you come south from that, you'll see bars where there's a big green bit at the bottom. Green is Hampshire hospitals, so that's Basingstoke and Winchester and Andover. So the green represents the proportion of people that would come to Hampshire hospitals for the most of their care. But you'll see that there's a little red ring. Those are going to UHS, that's Southampton. There's a small white ring, that's Royal Surrey. And then there's a bit of a blue bit, Portsmouth, and a purple bit, Frimley. So people in those bars go to a number of different hospitals, depending sometimes on their personal preference, sometimes on the particular specialty. There'll be a range of reasons. And you can see across this chart, as you come further south again, you start getting some quite solid blue bars. Those are people who predominantly go to Portsmouth, but also a little bit of Southampton and a little bit of Frimley or elsewhere. And then as you come west towards Southampton, you start getting the red bars that are Southampton Hospital. And then right over to the west, you've got the yellow bars that are Salisbury. And up at the very north of it, you've got the pink bars that are Royal Berks. So this programme is predominantly focused on the green bars, Hampshire hospitals. That's Basingstoke, Winchester and Andover. But when we're considering the impact on our population, we're considering this whole geography to understand whether changing the location of some of our services would change the choices people would make about which hospital to visit. What this doesn't do is require anybody to go to any different hospital. It's patient choice is still very much a factor. And what we're trying to do is actually present patients with better outcomes, better options, and as I say, provide much of what they do, of what they need, close to where they live. But we've included Surrey in response to your services. You can see that actually there isn't very much white on this, little white bars. and that's because actually we don't have a huge amount of overlap between the Royal Surrey and Hampshire Hospitals patients. Next slide, please, John. So we also just wanted to recap on the site selection process. Given that that's the geography we're looking for, we looked across that whole geography to find out where we could build a new hospital as part of the new hospital programme. We identified 9 sites in stage 1 that covered pretty much the whole of that geography. And in stage 2, we ranked them according to a whole load of criteria, transport factors being a key one, worked with the ambulance service about where a blue light ambulance can get to the most quickly, but also planning and environmental factors. That left us with 5 sites that we took forward to the next stage, and we've then been talking to the landowners, and we are down to 2 possible sites that are available and that meet the criteria and score highly in the site selection criteria. Those 2 sites, we told you this before, so this isn't new news, but just to confirm, they are still the 2 sites that we hope to take to public consultation. And the 2 sites are the current Basingstoke and North Hampshire Hospital site, including some adjoining land near that site. That would be a redevelopment, so is a more complex building project from that perspective, in that we'd be running a hospital while building a hospital. But has the benefit of already being on public transport links, for example. The second site is Junction 7 of the M3, just off the junction. From the ambulance service perspective, this is a better site. It's close to major road links. It's also a more straightforward build in the sense that you're not trying to run services from the same site as build them. It's more central to the overall geography. It is, however, from a public transport point of view, more challenging, and a big part of this programme, if we go with the Junction 7 site, will be ensuring that not only do we have plenty of car parking for people who have to drive or need to drive, but that we will have good public transport links to the new site. They don't exist currently today. So those are our 2 sites. I'm now going to hand over to Matt just to recap on the vision of the Hampshire Together programme. Thank you.
Thanks, Alex. With apologies to those of you who've heard me talk about this before, we just wanted to provide a brief recap, really, of our vision for the programme. Our central vision is to provide a health, wellbeing and care service which will support people to access the right care in the right place at the right time. And whilst it's a statement that sounds fairly simple and straightforward, I just thought it was worth exploring a little bit over a minute or 2, because the right care might be a doctor, but it might also be a multitude of other healthcare professionals, and the right place might be a hospital or might be a GP surgery, but might be somewhere completely different. It might be somewhere much closer to a person's home. It might actually be care provided in that person's home. I don't think Alex has mentioned COVID yet, which is a miracle for any presentation at the moment. But one of the things that we've learned and explored over the last year is an increasing use of information technology in the way that we provide care, and the way particularly that we provide joined up care between the hospital, GP services and social care. And whilst we recognise that there are people who have challenges with information technology and that it doesn't work for everybody, we think that information technology is going to provide a range of new ways of looking after people, which has the obvious advantage of making some of the geographical challenges less important, I suppose, because care can be provided from a number of different places. And whilst a large part of the money that's available is for buildings, information technology also counts, if you like, as infrastructure investment, and so will form part of the programme moving forwards. I think that's probably all I wanted to say about our vision, and I'm going to hand over to Ruth.
Thank you, Matt. Good afternoon, good morning even. So I'm going to start with a timeline and then walk you through some of the progress we've made since we last met. So our timeline starts with our intention and our wish to come and consult with our public in the summer of later this year, and then we move through a period of time of planning, design and construction. And as Alex said earlier on, we are in the second round of this next phase. So we hope to have our facilities open somewhere around 2028. So some of the update that I wanted to share with colleagues since we last met. As we know, our scheme, Hampshire Together, is one of 40 across a national set of schemes around health services. And so all of our schemes across the country have held meetings with the national colleagues in the Department of Health and Social Care over the last couple of months. So we had ours in February. It was a really positive discussion, and it's all focused on the progress we've made and the next steps in terms of how our programme comes to fruition. So a lot of discussion around some of the benefits of being part of a national programme, both around standardisation, around the digital opportunities that we now are available to us in terms of technology, but also, as Matt's alluded to, some of our learning through our COVID experience of delivering care very differently. And this really does afford us some opportunities we're looking to capitalise on. And again, that's going to be part of the national opportunity for all programmes a part of this scheme. So as I said, it's a really positive meeting, lots of feedback, and the final feedback is due back soon. And again, that will help us clarify our timelines with regard to our construction journey. So with regard to progress, we talked before pre-Christmas with regard to our pre-consultation business case, and we've made further development in terms of that piece of documentation since then as well. So lots of really good work going into that case. And you'll recall we talked a lot about our engagement work previously, which has been absolutely fantastic and really well received, and that continues. So we've done a lot more engagement over the last few months, and indeed over the next little period of time, we've got further engagement. So we have a public meeting tomorrow evening, which is all about getting to know your NHS. We continue to use multiple streams of opportunity to talk with people. So we have online surveys, and we also continue our work around having targeted staff and public focus sessions around all aspects of our programme, which continue to be really well received and go really well and draw really good interest from lots of our colleagues and indeed our public. So with regard to recommendations for our time with you this morning, there are 3 key recommendations for us to explore with you, Councillor Huckstep. So to note, this is an update report. To request any further information that you would like as part of this or future meetings. And to note that once our programme has been assured, we can proceed to consultation, we will discuss further with members of the committee about the proposed date by which we would require this committee to provide any further updates and indeed engage with our proposals through that process. So those are 3 recommendations we'd like to place this morning.
Thank you, Ruth, for that, and thank you to the others who presented this particular presentation. Am I right in saying that it has not been logged on to ModGov? Is it possible that we can have it on our ModGov machines after the meeting?
Yeah, we can send that over, yes.
Yeah, that's good.
I can circulate it afterwards.
Yeah, thank you, Marie. Right, now, what's interesting is in your last slide where you mentioned the recommendations, whereas you had 3, we have 4 on our paper. You've dropped one. Is there a reason for that?
Sorry, Councillor Huckstep. We've got the other one included as part of the update on consultation that Elliot will provide, which is
okay,
because it was to do with specifically that. Do you see what I mean?
Okay. It's not dropped, it's relocated.
To the next agenda item. Yeah.
Okay. Right. Members, are there any questions on what you've heard so far? Doesn't look as though there are any questions. Now, the event you're running tomorrow at 7 p.m, I know it's promulgated on the website. Where else have you promulgated it, if at all? For instance, have you used the Hampshire County Council website to publicise it?
Sorry, Councillor Huckstep, maybe I can help a bit with that. So we've cascaded it through, so it is a digital event, so we've so far only been able to use digital channels, but it has gone out fairly aggressively through social media, through the press, and then through our communications colleagues across both Hampshire County Council, Basingstoke and Dean, Winchester and others, we've asked them to share through internal networks. We've also been pushing it quite heavily to our own staff as well, since they are also members of the public. So far, I think we've got just over 200 signed up, or we had as of Friday. So far, so good. Of course, we could always use more. So anything anyone can do, please do lend a hand.
Okay, that's good to hear. I think I've got a question now from Councillor Carpenter. Councillor Carpenter.
Yeah, just a quick one. You've got those two options, the Basingstoke and the one on the M27 or whatever it is, M3, sorry. It looks as if you're sort of heading towards the Basingstoke one. Would you say that is more likely because of the number of people that are disappearing off north and northeast to other hospitals? Is that what you're thinking along those lines?
No, I'm sorry, it's Alex here. I think this is for the location of the acute central hospital. The really important part of this programme is that an awful lot of services will remain in their local areas, and so it's really so the number of people who will kind of have to travel a little bit further will be quite small, because it's only people accessing that really acute hospital. The vast majority of appointments, outpatients, diagnostics, day surgery, all of those things people will continue to have quite locally to where they live. The travel distance is one of the factors to take into account, but we were also, as part of our pre-consultation business case, looking at the cost of the building, you know, and it's differential costing in each of the two locations. We're looking at travel time for staff who get there. So there are a lot of factors to take into account in terms of where we choose to put that acute central hospital, but at the same time sort of remembering that an awful lot of things will happen locally. So when we go to consultation with the public, we'll go out with both of those options and kind of explain to the public what the pros and cons are. Yeah.
Is that okay, Councillor Carpenter? Alex, you've mentioned costings. This, I think it's fundamental. When it comes to option A or option B, and option A is going to cost X and option B might cost Y, are you in any way constrained by, as it were, the budgeted figure? Or is it the same figure for both options and you have to make best use of whatever lump of money you're given?
So where we are at the moment is we've been given some sort of indicative numbers, but there isn't a kind of clear budget. So it's a bit of an iterative process for all the 40 hospitals. Each area is being asked to review what they need and then go back to the centre and test whether that's within the right ballpark financially or not. So at this stage, both the two site options are within the ballpark of what we need to do. Once we've gone through public consultation, we then have to start building much more detailed business cases, and that's the point at which we would do much more detailed costing, and would eventually have to go through a Treasury approval process. So just coming out of public consultation isn't a final yes no. There's an awful lot more work and a whole load of more stages to go through before we actually start building. And a big part of that is the discussion with the Treasury about how much money is available.
Yeah, obviously that is going to be crucial. The interesting point, though, is if you favour a particular option, but it happens to be more expensive than the alternative, are you going to be overruled and told to have the lower priced option?
I think cost is one factor, but there are an awful lot of other factors. What we've been told very clearly is, you know, people don't want to spend hundreds of millions of pounds and build something which isn't the right thing, because this hospital's going to be around for decades to come. So it's quite important that we get this right, that it's in the right place, that it's accessible for our population, that it's that the building we build is carbon neutral, that it's a healthy building that allows people to recover, that it works for staff, that's, you know, staff stress and well-being is really important. So there's an awful lot of criteria here, and cost is one of them, but it's certainly not the only one.
Okay, I'm sure we'll come back to this again and again. I've got some more questions now. Councillor Harrison.
Yes, thank you, Chairman. I know that when you start asking the public what they think, they very often focus on specific details. And the problem with a big project like this is that you often don't have specific details hammered down. So if, for example, people ask you whether you're going to have car parking charges at your site in, say, Basingstoke, or how robust your public transport arrangements are you able to answer those questions? And if not, how do you propose to deal with it?
So the second one, the public transport, we are absolutely clear that all of our sites need to be accessible, and public transport is a key part of that. So we are actively talking to local boroughs and districts, as well as the Hampshire County, as well as Highways England, volunteer driving groups, all sorts of people, but recognising that we're not opening till 2028. So actually people aren't going to be, having detailed public transport plans that take them out that far, but we absolutely know that we need that in place. In terms of something like, what will the car parking charges be, if any? I honestly don't think we can answer that at this stage. I mean, I think, there's been national discussion about whether there should or shouldn't be parking charges for hospitals. We obviously refund parking charges for certain people on certain benefits. We don't charge our staff currently for parking. So that's where we are at the moment. But I don't think we would be able to say by 2028 what's going to be the policy on that at this stage. So there are going to be some things we'll have to say, I'm really sorry, but we don't know right now. Yeah.
Thank you, Alex. Question from Councillor Margetts.
Thank you. I was just thinking about the restructuring of the CCGs across Hampshire and what implications that will have for place-based services, and is that altering or affecting any of your planning? Thank you.
I'll take that one, Alex. Yeah, that's cool. Yeah, thank you, Councillor Margaret. So obviously the restructuring of the CCGs and our ICS coming together. So we're really basing this programme as an opportunity for the whole collective of providers and commissioning organisations to come together around this as an opportunity to support that design work. And it's completely supported by all the CCG colleagues across the system. And we've been working in that way collectively together over the last little while anyway. So it is part of our agenda and has been, so that won't be new. Clearly the formalisation of that means we have an opportunity to structure some of that work, but it's been an ongoing journey throughout collectively already. So I don't anticipate that being an issue. In fact, it's probably got some upside in terms of being a real opportunity to more broadly look at the proposals together.
Thank you, Ruth. I don't have any more questions. So is there any debate on the recommendations before we take them? I don't see any hands raised for debate. So we've got the three recommendations. That is to note the update report, request any information that they would like shared in advance or as part of the next or future meetings, and to note that once the programme has been assured to proceed to consultation, we will discuss with JHOSC members the proposed date by which we should require the joint HOSC to provide any comments on our proposals. So there are two there to note. Can we agree to note the two?
Agree.
Yeah.
Agree to note, Chairman.
Right, good. Now the other one was requests any information that would that they would like shared in advance or as part of the next or future meetings. I think that's my own opinion is that's a bit of an open question. I think we've got to leave it to you to decide whether there's been such a change in circumstances or information that's come your way that you really ought to tell us about it before we convene the next meeting, which is probably going to be in June. So I think I'm right in saying that we don't have a request at the moment, but I think the initiative has to be with you to decide whether there is sufficient change going on that you really ought to notify us in advance of June. Is that agreed?
We're very happy to take that responsibility, Councillor Huckstep.
Good. Thank you. So now we can go to item 7, which is the consultation method update. Now, we're looking at the same presenters for this, are we?
Elliot Nichols is going to take you through this, I believe. Is that right,
Elliot's going to do it. Well done, Elliot.
Sorry, you're stuck with the B team for this bit, I'm afraid, Councillor Huckstep, but
right.
I'll try and do my best.
Fire away. Thank you.
We do have a slide deck, so I'll just give John a sec to get that up on the screen.
Right.
Thank you very much. So if we could just, so right from the top, I should say I'm Elliot, I'm the Associate Director for Communications at the Trust. But as consultation sits with the Clinical Commissioning Group, I'm not actually leading it. So Emma McKinney is the Director of Communications at the CCG and is ultimately in charge of this particular work stream. But we are doing so in a very integrated way. So to be honest, for this particular programme, it's actually genuinely one team. I know it's a bit of jargon we use in the NHS all the time, but it's actually true this, so I'm quite proud of. So John, if you go straight to the next slide, please. So we are currently working on a planning assumption of a fairly standard 12-week consultation. As you can imagine, with any project of this scope and size, there are an enormous number of moving parts, and I believe it came up in the first round of questioning. So this is what we're currently looking at. So we've broken it down by clinical area, some other aspects of care such as integrated care and localization, and over all of that we're placing the geographic focus. Now, when we say neighbouring areas, that's when we're talking about Surrey and West Berkshire, and we're open to whether we do events for those specialist locales. But in each case, we would be looking to take, for example, cancer care. We would be looking at trying to help people understand what a given proposal would mean for, say, residents of Andover. What are the implications of option 2 for their cancer care? So it's an incumbent on us to be able to convey enough information that people can make an informed judgment on any given option we have. And it's entirely up to them which particular aspect is of most significance. It'll vary enormously person to person. We do anticipate that as we're hoping for a summer consultation, one aspect of uncertainty to throw straight into the mix is exactly what the COVID restrictions will be on physical public meetings and what that might mean for either our timescale or how we've ordered the weeks. So we might, for example, look to extend it by a couple of weeks if we can get a more public meetings of a sort of more traditional sort. Otherwise, we're planning for a primarily digital consultation. But we will definitely be staying in close contact with yourselves as to how that evolves and it develops. Next slide, please. So you should have a version of our consultation plan and document in your papers. We've got a detailed delivery plan by week. We haven't got firm dates associated with them. That'll only be, we can't finalise that at this stage, but as soon as we can, we will do so. It very much builds on what was achieved last summer. But also we've certainly done a lot of engagement work since then, which Ruth expanded upon. And we've taken all of that information and not only fed it through into options development and the decisions that have been taken, but we've also used it to inform how we've planned for consultation. So one of the areas we found surprisingly difficult was actually there were groups which we now call sort of digitally deprived, and they might be the more, and it's not easy to exactly quantify who that was. So we've done a huge amount of work, both with Healthwatch and other consultants, to work out how we engage with that group, even if we can't do physical public meetings. So we've taken that and listened. However, ultimately, and as I said at the beginning, our goal with this is to ensure we get high quality feedback from as many people as possible, but also taking into account different geographies, demographics, interests, communities, ethnicities, and we have an absolute obligation to do that, because otherwise it's not going to lead to a fair result. I would say that, as with any consultation plan, it is not a vote. It's not a referenda, and we'll be very clear with people that at the start it is one strand that goes into decision making. It is hugely important and will be absolutely taken into consideration, but it is not an election. So just because if we had sort of 70% of all the feedback was for option 2, it doesn't necessarily mean that option 2 is the one we go through. And I always feel I have to be very upfront with people when I'm talking about this. Next slide, please. So, well, we've got a fair challenge ahead of us, as you can imagine. Huge range of people we're looking to reach, and in fact, in your individual roles as councillors, if you would like to put us in touch with any of your community groups, please do so. We'll add them to the list. We've so far recruited 80 ambassadors who are sort of out there advocating for us, sharing through their own networks. That's both staff and public, and we're actively recruiting. So any volunteers, please put your hands up. We're developing a range of materials. So depending on what you count as consultation materials, we have to produce between now and when we start, somewhere between 300 and 400 individual items. So that's everything from your social media posts to detailed clinical fact sheets about what services and the implications it'll have on them, to travel times, to animations to ensure that there's some fairly complicated themes are conveyed in a way that's in plain English and passes that very important test. So you don't have to be, Matt or Lara to understand what's going to happen to your emergency department. That actually, even I could understand. So looking slightly beyond consultation, we are fully aware that this has to be not only technically independent, but thoroughly independent. So we have an independent agency who we've commissioned to do the analysis of all the feedback that we receive, and they will completely independently write a report on it. So there'll be there's no scope for anyone to say that it's been manipulated, and that report will be brought to yourselves for discussion. I do want to underline again, Councillor Huxtap, you mentioned a possible, when post-election the committee will be reformed. We don't know when we'll be lucky enough to go to consultation, but if social distancing restrictions do change, we would certainly look to get input from yourselves to ensure that we were doing enough to adapt our plans to the evolving situation, to reach out to groups who may not be able to do online only. And we'd absolutely want your input and, to be honest, approval of that plan if it does change. Of course, it depends on timescales. Next slide, please. So, in a nutshell, this is the range of activity we're currently looking to achieve. I would just highlight one or two of them. So our virtual focus groups have been a huge success, exceeding my expectations. So this is where we go to sort of, it might be the Cancer Care Alliance in Basingstoke. They gather together their members, and actually it gives us some incredibly informed feedback and some really powerful individual stories of what it might mean for them and what matters to them. That's just one example, and I could give hundreds. So when I asked somewhat jokingly at the beginning, if in your own divisions in seats you have community groups that we should be engaging with, please don't be shy. And I think that focus group tool is going to be really powerful. We are, of course, looking for it's a formal structure. So feedback primarily we're looking to gather through a formal form, which will be available in print and online. So we'll be pushing as many people towards that as possible. It won't be the only way, but it will be a very important way. And our main tool for conveying the information will be through the consultation document, although we will have a summary version. Again, that will be available in print and online. And we've got provisions in place to enable us for other languages, for easy read, and that'll be available on request. The physical stuff, well, I've highlighted we're really somewhat in the lap of the gods and that it's not in our gift and control, but just to reassure, we are seriously thinking about it and trying to come up with contingencies for how we could achieve it, even if in a very limited way. I think it's really important that we do some of that if circumstances allow. Yeah, thank you, John. So this is the website I was telling you about. No, it's currently undergoing a bit of a refresh. So this is how it looked for the engagement phase and currently looks today. So we're currently remapping it to ensure it's very easy to navigate, but we are putting as much information as we possibly can up on there. So the page you can see the screen grab of is useful documents, including some very technical materials will go up onto there. There will also be other things, so meetings that we record will be made available online here, so we can easily share it through other platforms, and individuals can do the same. We'll be putting, FAQs, so people can try and quickly find an answer, animations, fact sheets. This will be our main portal to try and create as much transparency as possible. And of course, there'll be a contact us. So if we've missed something, you can let us know. Next slide, please. So this is our ask. We will be planning to give written briefings every 3 weeks, and that'll be to not just yourselves, but all councillors who are in the affected area. We will be willing to consider either a formal or an informal brief if you wish to have a meeting that regularly, because I think it's very important that we don't just sort of have a, we'll come back to you at the end and ask you how we did. It's much better if we're doing something wrong, or if there's something brewing, that we get some continuous feedback. At the end of the process, there will be an independent report that will take some months to produce, so it won't be instant. So it'll probably be important to have a sort of what you might call a hot debrief with yourselves straight afterwards, but then a much more considered process of going through that independent report and sharing feedback. And of course, our standard commitment to regular meetings as and when you feel it's required. So I think this is where I pass back to you, Councillor Huckstep.
Thank you, Elliot. That's very useful. Again, I believe this presentation is not available to us either on our ModGov. Can that be circulated afterwards? Yes, I see a nod. That's good. Thank you.
No problem at all. Yeah.
Right. Members, questions? No questions? Councillor Harrison.
It's not so much a question, Chairman, but an observation. It really looks like every base has been covered here. So I would say very well done. You know, I hope it continues in this frame, but certainly that's a very impressive run through of what you're planning to do.
Thank you very much. If only all questions were like that. Thank you.
Agreed with that.
Yes, there must be general agreement with that, because there are no further questions coming up. So if there's also no debate, can we agree the recommendation?
Agreed.
Agreed?
Agreed.
Good, thank you. Right, so now we can move to the next item, which is item 8. Which is an exclusion of press and public. I need to read something formally to you. The recommendation for item 8 is that in relation to the following item, the press and public be excluded from the meeting, as it is likely, in view of the nature of the business to be transacted or the nature of the proceedings, that if a member of the public were present during the item, there would be disclosure to them of exempt information within the meaning of paragraph 3 of part 1 of Schedule 12A of the Local Government Act 1972. And further, that in all circumstances of the case, the public interest in maintaining the exempt information outweighs the public interest in disclosing the information for the reasons set out in the report. Members, are we agreed to proceed to item 9 under that stricture?
Agreed to proceed.
Thank you. Marie, you need to instruct the webcast to stop